Good afternoon, everyone. This is the afternoon of July 20th, 2022. It is a Wednesday afternoon, about 2 o'clock local time in the Quad Cities. Welcome to everyone, and welcome to any of our audience who are accessing this on demand at a later time. We are recording this, and it will be available on the Empowered Living Club website. This is the second in our series, on our monthly series of perspectives on aging in place, how to age in place and how to stay home longer. As I say, it's perspectives on aging in place, how to stay home longer and with better quality of life. A series of discussions with industry experts. And today I'm going to introduce Ron Calvert in a moment. We want to provide you with unique and hopefully empowering insights. This is not a presentation, it's a discussion. It is interactive between Ron and myself. It is not an interactive with the audience. Today's perspective is from the home care industry, the home care side, okay? The use of home care as a potential opportunity to help you stay at home longer and with better quality of life. So we're going to be talking about home care services. It is brought to you, for those of you who are not familiar or don't remember, it's brought to you by the Empowered Living Club, which is a part of Golder Care Solutions. This is a new community resource, and it's designed to empower all of us to meet the challenges of aging while embracing its opportunities. This is part of the educational offerings. And of course, the club motto is facing the challenges of aging together. As I said, I'm going to introduce Ron Calvert. Ron is a healthcare sales specialist. We have known Ron for many, many years and worked with him, I think, quite well. For that period of time. For the last how many years now, Ron? You've been with Good Samaritan.
I've been with Good Samaritan for 31 years.
Oh, yeah. Oh, yeah. That's right. You just moved within it.
That's exactly right.
Yes. Sorry about that. So
that's all right.
And I'm going to tell you in a minute we're going to have Ron tell us in a minute some of the things that he's done with Good Sam. But yeah, that's a pretty impressive tenure, I would say. But I want to preview the next 4 or 5 slides, and then we're going to come back to this slide and finish the introduction of Ron. Okay. This slide says, "Help! I fall and I can't get up." What happens when you can no longer care for yourself? That's a huge turning point for all of us in the aging process. Hopefully, we never get there, but many, many, many of us do. Well, if that happens, you need someone to help you. Okay, we need someone to help us. But who is it? And particularly where? Where is that administered? Where do we get care? Are we getting it at home, or are we getting it in a facility setting? So we're going to talk about home care. Obviously, as we said, this series is perspectives on aging in place and staying home. So we're going to be talking about getting care at home as a means of staying home longer. And there are a couple of types of services that we're going to be talking and differentiating between. And that's one you just call home care, and another one we call home health care. So before we get back to that, I want to go back now to slide number 5, if I could. And that is, or the next slide after that now, a little bit more about Ron. Ron, tell us, you in your tenure at Good Sam, what sorts of jobs all have you held, and what are you doing for the organization now?
Sure. When I first started out in the company with the nursing facility in the West Davenport is where I started out in the business office. But then we soon got into Medicare and learned the foundations of the Medicare program, and was instrumental in implementing the Medicare program into our facility in 1992. We took our first Medicare residents. So I overseen all the Medicare financials and everything for the facility. Then later I became the director of the rehab department, where I provided oversight to the therapists and still maintaining all the financials for the Medicare reimbursement as well as the Medicaid reimbursement. And then later I went on to become administrator of our services at home in the Quad Cities, which takes care of individuals in their home. And I was administrator there for 7 years. And then I went back to the facility about 1.5 years, 2 years ago as the director of operations. And in that role, we did that for about 1.5 years under some leadership changes after people had retired. So I did that. And now I'm into the healthcare sales specialist role where I'm doing business to business and sales, business development in the area, just marketing our home health care, our home services, home health, skilled nursing facility, and so forth.
So right now you're really, I mean, your experience is pretty much across the board with all the different parts of it. And that's what you're dealing with these days.
Yes.
In terms of you're into education, marketing, and sales, as I take
exactly.
it, really.
That is correct.
And so that goes right along. Your obviously your experience and your expertise goes along with exactly where we are on the topic today, and the sorts of things that you do are perfect for our guest, being our guest today. So thank you for joining us, and welcome.
Well, thank you for having me.
You're very welcome. Thank you. Let's go to the next slide. Again, once again, we said what happens when we can no longer care for ourselves. Then we need help. Where do we get it? Are we going to get it at home? Are we going to get it at home or in a facility? And today we're going to talk about getting care at home and that aspect of it. So it says here, type of services, home care versus home health care. So Ron, give us a little introduction to that topic.
All right. So I'm going to do the very basic difference between home care and home health. Home care is non-medical services provided in your home. And home health care is services provided in your home, but those services are provided by a nurse, a physical therapist, an occupational therapist, and a speech therapist. So the vast majority of the difference is one's non-medical and one is medical.
Okay, so the home care is non-medical and the home health care is medical care.
That's correct.
All righty. And you could be getting both of them at the same time. You could need and receive both of them.
You could.
Okay. All righty. So we have a slide for home care, and then we have a slide for home health care. And they both have pretty much the same outline here, which is different types of services, payer sources, and oversight and licensure matters. So in home care, the non-medical services, what sorts of things are typical, do you offer and are fairly typical to that?
In our home care, we can offer relief and respite care for individuals. We can do companionship. We can do bathing, dressing, meal preparations, laundry, light housekeeping, and shopping assistance, and many other things in addition to those services as well.
Okay, so respite is one of the things when there's a caregiver taking care of mom or dad or us, and they need a little break, right?
Exactly.
Okay, so that's kind of a short-term substitute for the caretaker, for another caretaker. Is that what you would say?
Sure, to give them a little break and allow them some time, even if it's just to get out of the house for a few hours for themselves, to give them a break from that, taking care of that individual.
So kind of goes to one of the reasons that people hire home care, and that is if I'm caring for mom or dad or my spouse or whatever, sometimes I want to be a family member again. I want to be a husband again or a son again rather than just a caretaker. Is that a fairly accurate benefit that a lot of people recognize?
Very much so, especially with kids that are still working and taking care of their own families as well, and they're trying to help out mom or dad in those situations. And a lot of times we can provide that service during the day while the kids are working, and then the kids will support the family in the evening or vice versa. It just depends on the schedules.
Okay. What other what other benefits do people find in hiring home care to come in to help take care of mom or dad?
Well, it's just that peace of mind, I think, is the most important when they're away from their loved one, that they know they're being taken care of and all their needs are being met. And that could be through med reminders, that just making sure they're taking their medications properly, that they're safe in their environment. If they have some dementia going on, that they're safe at home and knowing that they're not going to get confused and go outside in the inclement weather and so forth. So it's just really providing that peace of mind to the family.
So there's a safety factor as well.
Absolutely. Absolutely.
Okay. Particularly for people who need, say, 24/7 supervision.
Absolutely.
Okay. Payer sources for home care. Is there much in the line of insurance that pays for home care or not?
There are some long-term care insurance policies that will cover home care, and those are on a case-by-case basis. But our service line, if you come to us and you have some long-term care insurance, we'll be more than happy to contact that insurance company for you and make sure that the services will be provided and covered by the insurance. Otherwise, the other payer source is private duty, where you pay privately. And then we also do VA benefits as well. So if your loved one is a veteran, they may be entitled to some veteran benefits as well.
Okay, so the primary payer sources for home care, actual home care, the non-medical, are private pay. Okay, I can pay for my home care out of my own pocket. If I have long-term care insurance, that may cover some or all of it. And if I'm a veteran and I'm on the veterans medical, I can get the benefit that pays for some level of care and or some veterans respite care. Is that correct?
That is correct. Exactly.
Okay. But Medicare itself doesn't pay for home care. Is that correct?
That is correct. Medicare will not cover for non-medical services.
Right. So Medicare is medical insurance. There has to be a medical necessity or a medical need. And home care is providing for non-medical matters, correct?
Correct.
Okay. So, and Medicaid similarly does not pay for home care. Is that accurate?
Typically, Medicaid does not cover. There's always an exception, and it's based on state to state, but typically they do not cover home care.
Some of the Medicaid services, now there's different kinds of Medicaid, as you and I know. There is something called home and community-based services or waiver Medicaid, and that's intended to try to provide some kind of services to keep a person at home so they don't have to go into an institutional setting. Sometimes that might pay for some home care?
It may, and again, it's on a case-by-case basis.
Okay. So if somebody's interested in that, how do they find out about that?
If they're interested in finding out if they qualify for something like that, Milestones here in the Quad Cities would be the person to reach out to, and they can help those individuals determine if they would qualify for those benefits.
Okay. And Milestones here locally is one of what we call the AAAs, the Area Agencies on Aging. Is that correct?
That is correct.
Yeah, it sounds like I'm got you on the witness stand or something like that. Is that correct?
That's okay.
So I guess the answer is correct me where I'm wrong. It works with the state to make those determinations as to who's eligible for these home and community-based services and what kind of services they're eligible for, right?
Yes.
So, and there has to be some level of determination of need, something like that the AAA would do.
Yes, they most likely would reach out to your primary physician and have a conversation with your primary physician as well. Okay.
But if I just wanted some home care services, if I wanted companionship, somebody to come and talk to me or play cards with me or read me stories or whatever, take me to the mall or something like that, do I need to pass any kind of a of a need determination or anything like that?
No, not at all. These are services that are provided are non-medical, so they don't require any prior authorization for a physician. All we have to do is just sit down with that individual or their family, have a conversation what it is they're looking for services, and then we can provide those services and start the services.
Okay. So what I'm hearing is one of the nice things is that since home care is non-medical services and is largely non-regulated, so you don't have to have a lot of special licensure or oversight, you can customize those between the provider and the consumer of the services pretty much in any way you want to.
Absolutely. It's whatever works for the patient or the family in those times and what they need. Absolutely.
Okay. So I'm paying privately, generally speaking, and I can order up whatever services I think that I might need.
You can order up whatever services it is that you might need, and then you can also determine the time that you would need those services. And we offer services 24 hours a day, 7 days a week, 365 days a year. It can be anywhere from 1 hour of service to 24 hours of service per day.
So, okay, so that is nice in terms of the flexibility as well, in that you can determine how much service is consumed, and that's pretty much open to negotiation between the provider and the consumer.
Absolutely, because many times when we first start in with a client, no one's really sure how much time we're going to need to spend with them for sure. Is it 3 hours a day? Is it 2 hours a day? So what we do is we come in and we do an assessment, and we'll start off. I mean, we're only starting off for an hour or two a day, but we can certainly increase that if we need to. Or if we're, say they came home and they've had a procedure done and they need some services, we're in there, we may be in there for 4 or 5 hours a day in the beginning, but then we do, as they improve, then we cut those hours back to maybe 2 or 3 hours a day. So it's whatever the need is at that time.
Yeah. And I've seen that both ways in terms of we start out fairly low and we see if we need more, if that's enough, and if we need more, or we start out on what we think maybe a little on the heavier side. And if we don't need all that, we can kind of pull back. So it really is pretty flexible that way.
Absolutely, it is very flexible.
What if I'm paying privately for home care services? What kind of costs am I going to be looking at? Usually an hourly charge, is that correct?
It is. We do charge by the hour, and our hourly charge is $31.50 per hour. Now you can go up to 3 hours, but then if you go over 3 hours, then there is a discounted rate if you go over 3 hours in any given set time. So meaning you have to do 3 hours increments to get that discounted rate.
Okay.
Not an hour and a half in the morning, but an hour and a half in the evening. It'd have to be at one time.
Are there separate charges for like getting to the house, from transporting oneself to the house, the caregiver to the house, or when?
No, the time starts when we actually get to your home. Okay. So if you have 3 hour time block, it's going to start when we get to your house and when we leave your house. There's no travel time in between. Okay. You're not charged.
And that's one reason then that you can give a little discount when there is more than 3 hours, because there's not as much travel and things like that involved.
Exactly.
Some of those expenses are not as prominent then. So, okay, about $31.50. And my experience is that, traditionally was that home care probably was anywhere from about 24 to 36. And now that we've had the pandemic and we're having a hard time hiring people, I don't know of anybody who's doing it at less than about $28 an hour, $29 an hour and up. Is that your experience as well? Or?
It is our experience as well. As we've had to, increase wages and so forth, we've had to adjust for that. We want to make sure we're continuing to hire quality care individuals to take care of your loved one. So in doing so, we have to adjust those rates as well.
Okay. Let's go to the next slide a minute, and then we'll kind of go all over the board. But let's talk a little bit about home health care. So the healthcare services, what types of services are usually involved there, Ron?
Usually for home health care, it usually stems from someone who has been in a hospital, or maybe they've been in a skilled nursing facility for rehab, and they return home. They're able to return home, but they still need a little extra physical therapy, occupational therapy, or speech therapy, or maybe some nursing oversight. So those individuals would come into the home, provide a nurse to watch, maybe you have a wound, or just to make sure that you're progressing like you're supposed to at home, that you're not slipping backwards with your health condition. And then they continue with the therapy to make sure that you continue to strengthen and get well so that you can return to your prior level of function of whatever that may look like prior to your going into the hospital or skilled nursing setting.
Okay, so that those services are typically administered by physical therapists, occupational therapists, nurses, those sorts. Okay.
Yep.
All righty. So those are licensed healthcare professionals that do that. Is that correct?
That is correct. And those services then also have to be approved by your primary physician. Okay. Orders have to be written by your primary physician stating you need those services.
Okay. So in order to make sure that you're not injured by services that you shouldn't be getting, or to make sure that somebody is overselling you services that you don't need or whatever, there is that piece that the doctor has to approve that's what you're saying?
Yes.
Okay. And then that goes along with payer source too. I take it if the doctor says that these healthcare services are necessary, there's a chance that the insurance will pay for your care.
Yes. So the payer sources for home health are the primary payer sources, Medicare, and then there's also Medicaid that will cover that, and then there's also managed care insurance companies that will cover that payer source as well. Those all require the physician to be involved in the care.
Okay. So those are really, it's thought to be medical necessity types of things, which could bring in the payer source, the medical insurance payer source. Does long-term care insurance ever get involved in this part of it, or much at all, or not? Or is it usually the acute care insurance?
It's usually the acute care portion of it.
Okay, so the Medicare or the Medicaid, whatever. Okay. Do many people pay privately for home health care? Is there much of that?
There isn't. They could. It's not something that we see a lot of. The costs associated with home health privately paying it's quite expensive because of the fact that you're getting professional medical care without insurance. So you're paying for those nurses and therapists' salaries. So
at higher rates,
it's where you can be on Medicaid or Medicare. So
okay, all righty. But even if we've had people in older care who have ceased being covered by Medicare, say for rehab. And the thought is, well, we might be interested in paying privately for some additional services. Even in those situations, though, you really want the doctor needs to be saying, yes, that's appropriate, and have oversight over it. Is that your understanding?
That is correct. The doctor's involved, whether you're in a skilled environment receiving therapy and they're saying you no longer qualify for that, then there's other options, but the doctor's always involved in that.
Okay. So, and is the name that's used for this is home health care? Is that what you call it? Home health services?
Yes, the home health care.
Mm-hmm. Home health care. So, and your organization, I take it, does both.
That is correct. We do both. We provide the home health care as well as the home care. And those can, as you talked earlier about, they can piggyback on one another. So somebody could go home, for instance, out of a hospital, and maybe they need that home health care where they need the nurse, they need the therapist, and that all works well. And that's covered by Medicare and Medicaid. But then it's who's going to go do the grocery shopping for that person? Who's going to do their laundry? Who's going to help them be able to maintain that until they get back to that prior level of function that they were before they went in the hospital? So that's where those two can kind of piggyback together and help one another.
Okay. All righty. So the home health care allows people to return home rather than stay in the hospital or stay in a rehab facility. It helps them get home sooner and earlier in the process, so they can rehab at home to some extent.
Yeah. Some people are going to the hospital for something that's caused them to be there in the hospital, but rather than having to go to a skilled nursing facility for rehab, they may not need that extent, but they need a little help and assistance when they go home. That's where home health will come in on that piece of it. And the other piece is when they are in that skilled nursing facility, and they have been in there for, say they broke their hip and they had surgery, and then they're doing therapy and they're getting to the place where they can now return home, but they're just not 100%. Maybe they're at 95%, 95%. They just need that little extra to put them over the top. It doesn't require them to be in the facility any longer. It just requires them to continue on with that therapy at a little bit lesser than what they were receiving, but still get it at home.
Okay. So somebody who was in the hospital getting rehab, very often that's covered by Medicare Part A, the hospital Medicare. And if they go home then and continue some rehab, they might be switching to Medicare Part B, the medical part of it. Is that how it oftentimes works?
And, if they're going home with Medicare, there is the Medicare portion for home health, and then there's the Medicaid, and then there's always the Part B. So each one of those plays different variants in that.
So each case you're going to want to look at what all is available, what's needed, what's available, and how different ways of paying for it.
Absolutely.
Okay. And then what isn't covered by private benefits may be covered by Medicaid, public benefits, or it may be that you could pay privately if no other benefits are available.
Correct. Or even in long-term care, if you happen to have that for home care.
Sure. Okay. All righty. All righty. So let's take a look at the related issue slide. Although before I get into that, I think we covered it. The home health care is regulated. It has a licensure. Does your agency have to have a separate licensure as a home health care agency? Home health care agency or not?
Yes, it does have to have its own separate licensure to do that. And that's regulated by the state of each state, whether it's Iowa or Illinois.
So it varies from state to state, but
yes,
many states, they license the home health care agencies since they are in healthcare. And since they are oftentimes getting some kind of health insurance payment. But the home care agencies don't have to have that in most states. Is that correct?
That is correct. In most states, home care is not regulated through
certification and licensure and that sort of thing.
Right.
So then the oversight is an internal oversight that you have to do.
Yes.
Okay. All righty. And as we've said, that makes the home care is more flexible because of that. And you can kind of structure it the way you want to because you're not bound by a whole lot of rules. If you're concerned about the care you're getting, I mean, your work, and the oversight, you're going to work with the agency for that, or you may be working with, say, professional care managers. People, we've had people from, say, Golder Care who've done oversight of that sort of thing too. Related issues, kind of finding the right level of care, managing the costs of all of this. Do it yourself versus hiring professionals. We've had one reference to that in terms of you can be a family member again and not a caretaker. And kind of what do we do to plan ahead for emergencies? So I'm taking care of my spouse, and that's working out well, and I'm the caregiver. But what happens if something happens to me? So, well, let's jump to that one a second since I'm there. How do you handle that, Ron?
Well, what we would like to see is if there's a couple and they're doing it on their own and they're able to do that, that's wonderful. What we can do is we can come in, we can set you up for services. We can go through the paperwork, make sure we have all the emergency contacts in place. We always have the physician's name and number so we can reach them should we need to. We can basically put everything in place that you need to start services, but not actually start the services. So what's nice about it is kind of like a little insurance policy. It doesn't cost you anything, but it's already done and in place for you. So if one of you goes into the hospital and all of a sudden the husband needs services, all the family has to do is pick up the phone, call us. The paperwork's done. All we do is stop out at that point. Whenever they want us to come and start services, we would be there, but everything would be done prior to that.
So that really helps in terms of making sure that the services that may be needed are going to be there on the ready as needed.
Absolutely. You know, I'm a firm believer in planning ahead and being in healthcare for as long as I have. I probably think more ahead than the average person does. But, you know, we always want to make sure that when an emergency happens, now you're reacting and you're trying to figure out. Some people don't even know the services are out there or available to them through home care. So where do they go? Where do they look? So I always say, do your homework first before you need it, so that when you do need it, you know what's out there and what you can have for services that benefit your loved one.
Right. And as we like to say, one of our mottos is it always seems too early until it's too late. Mm-hmm. And it always seems too much until it's not enough. Right. So really, we encourage people, we encourage everyone as we're all aging. I don't know of any of us who are going backwards. As we're all aging and we start to reach the point in our paths where we're dealing with these kinds of issues, it really is important, I think, from our experience at Golder Care and from what I'm hearing Ron say about his experience in the industry, it really is important to make these arrangements ahead of time so that things will be on the ready when needed. Because otherwise, as Ron says, you know, we're really in kind of a panic mode, and it gets in the way of our perceptions and our ability to think it all through. So that's good. And you're willing to do that with people, sit down and put that stuff together and have it all ready. It's kind of like a pre-order. Is that right?
It is, absolutely. And at any time, and we'll sit down with anyone and discuss our services free of charge, just to find out if it's something that's even interested with the family, or if it's something that their mother or father needs. There's no cost to that. We'll come out and visit with you and help you determine if that is something that they need.
Okay, great. Let's talk about do-it-yourself versus professionals. Obviously, a lot of people are sucked into becoming caregivers or at least care managers for other family members. It can be themselves, it can be their spouses, it can be mom, dad, you know, other brothers and sisters, kids, grandkids. And so we get into that sort of a situation, but there are professional services that are available, you know, particularly in the home care industry. What are some questions that you run into frequently, Ron, about the difference and what the benefits are of utilizing professionals?
Sure. The do-it-yourself happens a lot of times with, as you said, maybe there's grandkids that want to help out, or there's kids, and that's fine if it's within the family, you know, those individuals well. Where we see some problems have arose in the past, or when we have families who will go out and they'll know somebody in the neighborhood, or somebody says, well, I'll come in and I'll do these things for you, for your mother or your father. The concern with that, and the biggest thing that families need to be aware of, is those individuals are not insured and bonded by any means. And if something happens to your mother or father while they're with that individual and they go to the hospital is going to start asking questions on who are you, what is your experience, what is your knowledge, those things. That person then it can be responsible, but then because they're not the professionals, they have no one to go back to and say, hey, what happened? So they're coming back on the family, and it looks like sometimes that they're not providing the best care they can for their loved one, even though that was their intent, through the eyes of the hospital, that is not perceived that way. So I always say, leave it up to the professionals. We are insured and bonded. We can do those things. We're going to be there. If there's a problem, we're going to go with them to the hospital and so forth.
Yeah. So that certainly goes along with our experience, and I would really emphasize what Ron's saying. If you've got somebody who isn't qualified and is doing certain services, and something doesn't go right, they can be, and or you can be, if you've hired them, thought to be neglecting the person you're caring for. And that's not a good thing to be found to be an unfit caregiver. We've seen it happen. We've seen it happen in multiple families. We've seen it happen in some very, very well-to-do and prominent families where the person, the Department, Adult Protective Services, Department of Human Services said the care being rendered is inadequate. All righty. I think that if you're doing it yourself, you want to do it yourself and you want to hire somebody to come in, and that's always a temptation because if you're paying $32 an hour or whatever you're paying for an agency to do work, and somebody says, well, I'll work for you, I'll do it for 20 bucks an hour. It's awfully tempting to say, well, instead of using an agency, I'm just going to have that person come in. But that person oftentimes doesn't have backups. It means you've got to do the Patriot Act work to make sure that they're appropriate to do it. You're going to have to do the tax withholding. If you don't do the tax withholding, you personally, not maybe just mom or dad, but you personally, as the manager of this care, may very well be liable for taxes if this person doesn't pay all the taxes. You can also have issues with wage and hour administration. That can be a potential problem. Workers' comp. I've had experience myself. I've got one case I right now call 30-30-30. 30 years ago, actually more, we had a situation where people hired a nice lady to come in and help. She helped her son-in-law move and injured her back in the process. And then when she went back to work helping take care of mom, it made her back injuries worse. It exacerbated the injuries. And as I say, 30 years ago, the family that we had ended up spending $30,000 to defend the case and another $30,000 to settle the case. And that's 30 years ago. Think what those figures would be today. So you got to have workers' comp if you're going to have people in the house. There's just no other way about it. And another, what we would call another compliance trap that we see is what we call the gifting double jeopardy rules. So a lot of times people who come in and render care want to be paid directly. Maybe they want to be paid in cash or what we would call under the table. Well, if we ultimately have to place mom and apply for Medicaid, so that person is generally going to say, it's not going to be available to say, oh, yes, that's the charges that I was making. Okay. And so Medicaid might say, well, you were essentially making cash payments to this person and they were gifts. All right. So mother could be disqualified from getting public benefits that she might need. And this person, particularly in the state of Iowa, might be found, might have problems with what we call the double jeopardy rule, which is that the state could go back and say, this lady gifted you a bunch of money and now you owe that back to us, the state. So there are a lot of compliance traps in going with the non-professionals too. And that's just, Ron and I talked about when we were preparing for this, maybe we do a whole program on that sometime, some of those kinds of issues. But we at Golder Care always recommend that it be done professionally. And that means that you either hire an agency such as Ron's, an organization such as that, to provide the services and manage the services, or that you have to do that yourself and assemble a team. And there's a lot of work to that. There's a lot of potential responsibility. And again, now you're no longer a husband or a daughter or whatever. Now you're a full-time care manager, it seems. So I would say that would be one issue.
One other thing I'd like to add in there, Jamie, is we talk about that do-it-yourself versus professionals. While home care is not mandated by licensures and all the certificates and so forth, we do go out and beyond, and we train our staff with a minimum of 12 hours of training per year, so 1 hour a month. And that's on how do we work with seniors and individuals with dementia? How do we properly transfer or shower and bathe individuals? So there's lots of trainings that we put forth with our caregivers in the home care industry, even though it is not required or mandated. Whereas you do it yourself, they're just kind of going based on what they think is right. Even just in transferring a patient from bed to chair or from toileting into the bed, if you don't do those transfers correctly, there's going to be two injuries, one of the healthcare provider and the other of the patient. So the last thing you want is for mom to fall in a transfer, or father, and have a broken hip in the process or so forth, or create further injury.
Yeah. And that training, I think there's another part to that I see, and you can tell me if I'm wrong. I presume that at some point, some of the training is just in kind of proper procedures. So let me state, when we see senior abuse, okay, whether it be particularly financial exploitation, maybe not physical or sexual abuse or emotional or neglect, but when you're talking about financial exploitation, most of those cases, or many of those cases, start out with a pretty good relationship and a well-intended one, either between a family member or some informal kind of a caregiver and the family. And then they have a tendency to kind of get out of line. And so I presume that both in your training of the people you have do your staffing and in their oversight, you're looking for those things to try to make sure that, and training for those things to make sure that we don't go over the line and get into the bushes that way.
Absolutely. Just making, again, our goal there is to make sure everyone's safe, whether it be the caregiver or whether it be the client.
Right.
Safety is first and foremost.
Yeah. So, yeah, those are some points that I don't always think of myself. So, yeah, I feel very strongly that if you're going to get care at home, or very much of it, you really need to be utilizing professionals. That's the way to go. We got a couple other things listed here in terms of finding the right level of care, managing costs of care. There are different kinds of agencies, et cetera, et cetera. What would you recommend that people look for, and questions they ask, or anything like that?
When you're looking for the right level of care, is just really have that agency, whether it be home care or home health, whichever one it may be, have them come out on site and see the patient or the client. We usually come out, we do an intake, is what we call it. We come out, we meet the client, we meet the family, and that can take anywhere from 15 minutes to, I've seen it take 2.5 hours or 3 hours, and that's okay. There's no charge for that, but we want to make sure that when we leave, everybody has all their questions answered and that they're comfortable with what the decisions are being made. And there are many times where mom and dad maybe feel they don't need the help. That happens frequently, or mom and dad feel they can't afford that help. So part of that, managing the cost of care. And a lot of times the kids would be like, you know what, we'll just take care of that. Because that's, again, it's that peace of mind, making sure that mom or dad have what they need. Because so many times the parents, they just don't want to give up that independence, or to feel like they're a burden to their children by needing services or help. So it's always making sure we're meeting that level of care that's going to keep them in their home the best they can, wherever that is they call home, and to make sure they're the safest they can be while they're at that home.
Right. We see a number of times when maybe we reassure the people, you do have enough money,
Mhm.
at least for the time being. And these are services. This is what the money is for,
Mhm.
is to help you with that. And it's our experience as well. There are times when the family members will say, we got enough money, we'll kick in some money to help with that. So that can be very, very helpful as well.
And the other piece of that, Jamie, I think is important is if somebody's living independently in their home, and now we start looking at, does mom or dad need to go to assisted living?
Yes.
So we all know assisted living has its costs, and so does a long-term care facility. But what's important to remember is if the goal is to keep mom or dad at home, look at what it costs for home care in addition to living at home, and how much money can you spend on home care, and how many hours can you get before you're at the cost of assisted living. So,
Yeah.
and that's going to vary from many places, but maybe it's 8 to 12 hours a day that you can have care for before you're at the cost of what assisted living is. And again, assisted living, you're not having 24-hour care, but you're having it as you need it. But that's what we're doing at home. And again, the most important thing is what's best for the client. Is that for them to remain in their home where they want to be?
And am I correct in hearing that even if you're looking at that comparison and you say, how much money do we have to spend in home care services before we equal the cost of assisted living? But that's simply a metric. I mean, that's not an automatic point where you say, well, okay, now we need to go. We can't justify home care and we need to go into assisted living. Mom needs to go to assisted living. I mean, if we want to keep home health care, and if there are other reasons to keep it, it may very well be worth the money we're spending for it.
Right. Absolutely.
Okay. And another thing that you touched upon there in terms of the hourly and the care. At an assisted living, it's the availability of certain care. You're not getting care all the time. And or at any of the facility settings. Usually with home care, and when it's being done on an hourly basis, that person is to be there pretty much for you all of those hours. Is that correct?
That is correct. Yes.
Now, there is a form of home care sometimes where somebody kind of comes in and lives for a prolonged period of time, and they actually say sleep at your residence too. That's not something where they're obligated to be awake every hour, and we're not necessarily paying for hours. Is that right?
Correct. So what we can do is we can provide 24-hour care, as I said. Now, there might be times where you just want someone there during the night hours while mom or dad are sleeping, and you're okay with the caregiver sleeping during that time. There is a discounted rate for that. So they're not paying that full rate for those hours that and then you decide what that is. Is it 6 hours or 8 hours? But then what that does is the family knows, okay, the caregiver's there in the event mom needs them or dad needs them, but they are allowed to sleep. We do have those others where we have staff 24 hours a day and somebody's awake that entire 24 hours a day. We run that with different individuals. Obviously, we're going to run shifts of like 2 12-hour shifts, and so forth, so that we can make sure that somebody is awake all hours of the day.
Yeah, and that's a nice thing. I don't know how often you utilize that, but it's a nice thing I think, for people to know, because when you're paying hourly for home care, technically that person, I mean, sometimes we've all heard of arrangements where the person sleeps or whatever, but technically, if you're paying them for an hour of care, they're supposed to be awake and ready to render the care, even if you or mom or whoever is asleep in the bed. But having an option to have somebody there who is allowed to sleep and can have some cost savings, but they're there if they need to be, that's a nice option, I think, for some people to have.
Absolutely.
Do you run into that very often?
Yeah, once in a while we'll have people who, just want certain people for, sometimes we just do overnights. We don't do anything other than overnight, just so there's, because the family, again, is able to take care of them during the day, maybe into the late hours, but during the overnight, they want somebody in the house, so we'll come in and take care of them just for that time as well.
Okay. do you have very many cases where you have to do like a 24/7
We
home
average
care?
about 4 or 5 cases a month that we do that.
Okay.
That is not for everybody. Financially, it's not. We have to look at, again, you have to look at what the metrics and what that looks like. Obviously, when you factor in 24-hour care 7 days a week, it gets a little pricey for a full month. Now, if somebody wants to still remain at home, we can certainly do that. And we can provide those cares for those individuals. You just have to look at what's most cost effective and what the metrics are for each individual.
And I guess, and we're kind of getting toward the end here. When at what point would you say that it may be that somebody may need to go to an institutional, what I would call a facility level of care, a residential facility? Any particular turning points or?
Well, I think when you look at cost wise, it's probably, if you're running home care 12 to 14 hours a day, it's probably going to be more advantageous to go to a long-term care facility, because at that point you are going to get 24-hour care, somebody there 24 hours a day. Not one-on-one care, though. That's the difference, is
right.
You're going to get 24-hour care. Someone's going to be in the building 24 hours, but you're not going to get the one-on-one care, which is what you're going to give up if you're giving up to 12 to 14 hours. So,
right.
So it's not really comparing that apple to apple, if you will, or orange to orange, but in the home, you do get the one-to-one care. But if you were to do that 24 hours a day, it's going to be about double what the nursing facility would be.
Okay. And so, yeah, and I think that's a good point. The reason facilities exist and they're able to render care at a level that's less than one-on-one for 24/7 is because of an economy of scale. They have you and me and lots of other people there, and so they don't have to have staff to a one-on-one ratio, and they can charge a little less because of that. So, yeah, that's a nice thing. What happens? Let me ask you this: do you have much experience with people who really don't belong at home because they need a higher level of social interaction and social stimulation? I know we've experienced that with some people where they really almost need to be in a congregate setting.
Mm-hmm. There's occasions where we will go in and meet with someone and think, okay, this is more than what we can handle in home care. Then we have to have that conversation with the family, because again, the ultimate goal is to make sure they're safe. And if you go in and someone's got dementia, severe dementia, and they're living on their own, then we can do that, but you're probably going to need 24-hour care. And are you willing to do that? Because, with dementia, I mean, they can, if they're home by themselves, they can obviously go out the door, they can do different things, and then you're not sure what's happening with that. So we always want to make sure that it's what's right for that particular person. We'll have that conversation. If we can't help you in home care, we certainly will reach out and help you find a location or a facility, whatever that fit is for your loved one. We're not just going to walk away and say, well, we couldn't help you, but our goal is always to help you find that, whatever that service line is you need.
Right, right. Well, I see that we've spent about 55 minutes having this conversation. I guess is there anything that you can think of right now that you definitely want to make sure everybody knows that we haven't covered?
I think we've covered it all. I would welcome questions to that. And I always encourage everyone, if you have a question, pick up the phone and call. You can call myself. You got the information there. You can call Jamie. You can get to me or what have you. But always know what's out there for you and your loved one, because it's so important to do that, and do it ahead of time. That's all I can just reiterate, that. Do it ahead of time. Yeah. So important.
I do have two questions. Okay. One is consistency of the caregivers. Now, I realize there's turnover, but is the goal to have a consistent caregiver for a person, or is it, whoever's available that day?
That's a great question. We strive to make sure the personalities work, and personalities are very different on individual people. We will do our best to make sure we have consistent caregivers with the patients. Now, if we have somebody who's getting, 3 or 4 hours a week, 5 or 6 hours a week, that's pretty easy to do. Where we get into a little more difficult time is if we're doing a 24-hour case. We're going to try to minimize the number of caregivers that we have. And instead of doing 2 12 hours, we might have to have 3 in there and do 3 8-hour shifts. But what we'll do is try to get 3 or 4 core people for that person's care. So it's the same people, because it's important for a number of reasons. Number one is just for the consistency for that client. So they know who's coming to their house every day. They get to build that relationship and form a bond with those individual caregivers. So we do our best to have consistent care. And there are times when we'll make a match with somebody and it just doesn't work. And that's okay. We change them out because we understand personalities are different. But we get to know when we come out to do the intake, what's your mom or dad like? You know, do they watch television at 11 o'clock at night? If we're going to be in there, how long? And then we find caregivers who have those same interests in different things so that we can hopefully make a good match and a good fit.
Okay, my next question is, you talked about respite being available. And I know at Golder Care, we've had more than one family situation where the family caregiver has to have surgery or some kind of medical procedure, or they have to travel for whatever reason. Is this a situation they would meet with someone like Good Sam to set up caregivers to cover for just those few days?
Absolutely. We had a client who he had a stroke and he was in his home. His wife took care of him. However, she was very active. They had children in Minnesota and other states. She would then travel those places and hire us to come in and take care of him while she was gone. So there was care there for him, but she was able to do those things as well. She even went out of the country on a trip with a couple of her kids, knowing we were able to do that. The other piece that's kind of interesting is with Good Samaritan Society, we're across the United States. We are not just in the Quad City area, but this same family member had a granddaughter get married in Minnesota, and they wanted the grandfather to go. He went with our caregivers and then met up with our team in Minnesota, who then took care of him at that wedding as well. So the family could have their time to enjoy with the wedding and with all the festivities, knowing that dad was still taken care of. So we can do that. And there's an individual we take care of, lives up in Wisconsin. He comes to the Quad Cities about twice a year to visit with someone, stays in a hotel with his wife. They hire our services. We go in that weekend and take care of what his needs are. We help get him up in the morning. We help get him ready for bed at night, those things so that she can have time and enjoy their visit.
Those are some good examples, I think. Great examples of the flexibility of home care.
Or even just somebody who has a wedding and they want the grandparents to be there. Well, we all know how time consuming. You can hire the caregiver. That caregiver will come dressed appropriately. If it's a church wedding and you want them dressed, they will come dressed. They won't be in their scrubs. They're going to come dressed just like a guest to take care of that loved one. And nobody's going to know. They're not going to have their name all over their uniform or anything like that. It's just going to be if somebody tells them that person's for there. So
and we actually attended a wedding a couple of years ago that the grandmother came and there with a caregiver. And grandma was in a wheelchair and the caregiver came appropriately dressed, sat with her, assisted where needed, and would just fit right in with the crowd.
Absolutely.
That makes it nice.
Now,
and that gets it back to that whole thing about you're no longer just having to be a caregiver. You are allowed to be a family member. You're allowed to enjoy the family activities.
If there are additional questions you think of later, you can always send them in on the screen. You see the email. You can always send them to us and we'll get back to you then with answers to your questions.
Well, if there's no further questions, Ron, we want to thank you very, very much for your help today and really good solid information and helping us really sort some of these things out. There really is no no substitute, I think, for the availability of home care to stretch the ability to stay home.
Absolutely. Well, thank you again for having me. I do appreciate it.
All righty. Thank you, everybody, for attending. We have some upcoming perspectives on aging in place. As I said, we're doing these monthly, and we'll do another one come August. You will be getting notification of that. And I guess what's our next slide there, Gail? Well, thank you for joining us today. And did we leave you with, I don't remember if we had Ron's card or not on there. There it is. Okay. So there's information. If you're interested in contacting Ron for whatever reason at this time, or perhaps in the future, you may want that information. If you don't have that, you're certainly welcome to contact us and we can give that to you. Otherwise, you can look him up at Good Samaritan Society here in the Quad Cities. So once again, thank you and enjoy the rest of the day, and we will see you shortly. Goodbye now.